slide, which is labeled scleroderma. What is the problem in scleroderma? What will happen to the organ affected? What condition will develop in an organ affected by scleroderma, particularly systemic scleroderma? The systemic sclerosis. What? That is what will happen in an organ affected by systemic sclerosis. How do you call that change? How do you call that change in an organ? Ano? No, that is not dysplasia. How about that pointed portion? We are able to see wavy bundles of collagen fibers. What is the specific histologic term for that? Fibrosis. Okay? There is excessive deposition of collagen fibers that will develop in systemic sclerosis. Specifically, the organ affected here is, according to your manual, this organ is scleroderma. The lungs. Okay, the lungs. So that those spaces should be the, if we are looking at the tissues of the lungs, the spaces should be, how do you call? What is the specific name of the spaces? Those vacant spaces. The alveolar spaces. And then the problem that will develop in the lungs in systemic sclerosis is the development of fibrosis in what particular component of the lung? The interstitium. So, okay? So there is fibrosis that will develop in the interstitium of the lungs. So that should be the pathology of the abnormality that you should be able to identify for this slide. The presence of fibrosis in the interstitium of the lungs. And then aside from that, accompanying fibrosis are those white blood cells infiltrates. So basing on the morphology of the cells pointed, is this condition an acute or a chronic process? Chronic. Okay, we are seeing mononuclear inflammatory cells. So this is the main abnormality that you should be able to identify for this slide. So excessive formation of collagen fibers by those cells. How do you call those two pointed cells? They're the ones responsible for producing collagen fibers. They are the fibroblasts. So that is the pathology that you should be able to identify for the slide on scleroderma. Okay, our next slide is 152, number 152 slide, acute glomerulonephritis. How is this slide described in your manual? Suboptimal. Because this slide is already very much faded. So we are not able to see violet stain anymore. Puro pink stain na lang. So our area of concern should be the glomeruli. So acute glomerulonephritis entailing What should be present in the glomeruli? Acute inflammation will entail the presence of what type? Okay, neutrophilic infiltrates in the glomeruli. So unfortunately, because of the age of the slide, we are not anymore able to appreciate the neutrophils. Aside from the neutrophils, there will also be proliferation of the vascular endothelial cells, the mesangial cells that will develop in acute post-streptococcal glomerulonephritis. So unfortunately, those features are not shown in our slide. So that we will not be showing this slide also in the practical exam. So just look at the picture in your book regarding the histology of acute post-streptococcal glomerulonephritis. So there is a good picture shown in the chapter of the kidney disorders. Okay? Acute post-streptococcal glomerulonephritis. Our next slide is supposed to be slide number 153, lupus nephrosis. Wala dito. Anyway, we will skip that slide. We will proceed to our next slide, number 154, which is diagnosed as membranous glomerulonephritis. So unfortunately, we are not yet... Okay, balikan lang natin yan. Unahin muna natin ang membranous glomerulopathy. Unfortunately, we are not yet in the chapter of kidney disorders. So, however, we are in the chapter of immune disorders. So, this slide is included here because of the mechanism of the development of abnormality in the affected glomeruli here is secondary to an immune disorder. Okay? So, membranous glomerulopathy can be diagnosed by light microscopy because of the characteristic change that will develop. Remember that the condition is not, the name of the condition does not end with the suffix itis. So that characteristically there is no obvious inflammation that will develop in this condition. The problem will come in the thickening of the wall of the capillaries. Okay? What role is played by the capillaries inside the glomerulus? Okay, filtration. Unfortunately, if the wall of the capillary becomes thickened, that filtration function will be lost. Eventually, what condition will develop to the patient? Okay, very good. There will be development eventually of renal failure. So that is for sure a capillary because we are able to see that cell which is an RBC, red blood cell. So notice the wall is already markedly thickened, the wall of the capillaries. So basically, the cause of the thickening of the capillary wall will be the deposition of antibodies and complement proteins. So, because antibodies are deposited, what type of hypersensitivity reaction is involved here? Type? Okay, type 2. So, that is the abnormality that you should be able to identify for this slide. Membranous glomerulopathy. So, increase in the thickness of the capillary wall. Okay, so notice that that capillary wall is already, that portion of the capillary wall is already markedly thickened. So notice also that there are no white blood cell infiltrates in the glomeruli. So that the name of the condition ends with the suffix pathy and not itis. So low power magnification view showing us the thickened wall of the capillaries. We will now go back to lupus nephritis. What type of hypersensitivity reaction is involved in lupus? SLE. Type 3. Type 3 is also called as antigen antibody complex mediated. If immune complexes are deposited in the wall of a blood vessel or in the wall of an organ, what will happen to that organ? There will be destruction. Tissue destruction will result secondary to the deposition of the immune complexes. What will cause the destruction of the tissue? Complement system activation. So how will the complement system become activated? By a what pathway? The classical pathway. However, we are able to see neutrophils. Those are neutrophils, polymorphonuclear cells present within the glomeruli. They are not normally present inside the glomeruli. What is the neutrophils, when they release the contents of their lysosome, will also add to the injury that is already produced by the membrane attack complex of the complement system. What will attract the neutrophils if immune complexes are already present in the glomeruli? C5a, very good. Okay, so the abnormality that you should be able to identify for this slide is the presence of the neutrophils. So notice the segmented appearance of the nucleolus of the pointed cells. They are not supposed to be present in the glomeruli. Okay, so acute, that is why this is called acute, because of the characteristic polymorphonuclear infiltrates. Acute glomerulonephritis. Increased cellularity in the glomerulus because of the infiltrations of mostly the neutrophils, because they are attracted by C5a from the activation of the complement system via the deposition of antigen antibody complexes. Now, our next slide is labeled as rheumatoid osteoarthritis. What particular organ is affected? The joints, okay? Now, what type of tissue is pointed? How about that one? How about that one? Close-up view, those are lacunae, which should be housing osteocytes. Okay, what tissue is pointed? A bone tissue. Characteristically, compact bone or spongy bone? Compact bone or spongy bone? Spongy. So that the space should be the space pointed should be anong laman ng cancellous bone? the yellow marrow, and then this is still red marrow, bone marrow. Okay, bone marrow tissue. However, our concern for this slide will be the abnormality that has developed in the articular surface of this bone. So, zooming in, what type of cartilage is present in the joints of the long bones? Okay, I'm sorry. Okay, what type of cartilage is that? The hyaline cartilage. Now, the abnormality that you should be able to identify for this slide will be seen primarily in the synovial membrane. So remember that a synovial joint will have a joint capsule. Okay, meron siyang joint capsule which is composed of hyaline cartilage. And then within that joint capsule is a space which is called the synovial space. Okay? And then the surface, the inner surface of that synovial space should be smooth. However, in this slide we are able to see tongue-like projections already of the synovium. So, or the inner surface of the synovial cavity. Now, what is causing the formation of these tongue-like projections or villi structures in the inner surface of the synovium? Okay, so on high power magnification. Okay, identify the cells pointed. Okay, so para silang RBC tingnan, but however, walang central area of pallor. And then remember that our slides is much older than you. So actually, violet supposedly ang color. Those are nuclei of lymphocytes. So lymphocytes. So that what type of inflammation is involved here? Chronic. Okay. Now, okay, the cause of the formation of the villi-like structures is the presence of numerous infiltrates of not only lymphocytes but also macrophages. And then the B cells will transform themselves into plasma cells. Now, rheumatoid arthritis will develop secondary to the formation of antibodies against a still unidentified antigen in the joints of the synovium or in the tissues of the synovium. Okay? Unfortunately, up to now, hindi pa na-discover kung para saan na antigen yung na-produce na antibody that will bind to the tissues of the synovium. And then why are the white blood cells there if abnormal antibodies have been deposited in the tissues of the synovium? So mayroong abnormal antigen sa tissues ng synovium. And then because of the presence of still unidentified abnormal antigen, the immune system will respond by producing antibodies that will bind to the antigens in the synovium. What then is the cause of the presence of the lymphocytes, the plasma cells, and macrophages if the antibodies are already deposited? Ano? Okay, the FC fragment will the complement system will become activated through the effects of C5a. The white blood cells will become recruited to the site of antibody deposition. So, such is the problem that will develop in rheumatoid arthritis. So there will be alteration already in the architecture of the synovium, and then there will be development of chronic inflammation which will still present with redness, swelling, and then pain. So thus the swelling, the pain, and then the redness that will be felt or that will develop in the affected patient. So, basic problem in rheumatoid osteoarthritis. So, the presence of white blood cell infiltrates in the synovium. So, because of their markedly increased number, they will eventually form the tongue-like structures. So, the abnormality will be seen in the synovium. The bones will be normal. Okay, another portion of this slide showing us the tongue-like projections, which are actually composed of white blood cell infiltrates. Okay, that's the videos that we have seen a while ago. Now, if rheumatoid osteoarthritis is a chronic process, how will you call that change? Fibrosis. Very good. Which is another feature of chronic inflammation, a manifestation of repair. So what is the other histologic evidence of repair? Which is a characteristic of chronic inflammation? Fibrosis and angiogenesis. Although mononuclear infiltration is a histologic feature of chronic inflammation, it is not an evidence of repair. So, angiogenesis and fibrosis. Okay, so that you will be able to appreciate the pathology of our next slide, which is diagnosed as pemphigus. We will begin with the normal portion. What type of epithelium is shown? Keratinizing. So that we are looking at the histology of what organ? The skin. Okay? The problem in individuals who will develop pemphigus is that they will develop blisters in their skin. So have you seen a blister already? Yung matalsikan ng mainit na mantika. So the lesion that will be formed, which is fluid filled, is called a vesicle or a blister. Common name ng vesicle. Now, that vesicle will have that characteristic histologic appearance. So that colorless portion will represent the water which has accumulated within the epidermis. Okay? So that's the stratum basale. It is already separated from the superficial layers in the skin. So if that is stratum basale, that should be spinosum, granulosum, and then corneum. So the separation of the layers of the skin is secondary again to the deposition of antibodies to abnormal or to normal antigens in the stratified squamous epithelium. Now, there are several types of pemphigus. You will discuss each type more thoroughly in the chapter of the disorders of the skin. So there are actually several locations of the blisters that will form. So one type will be that type which is immediately above the stratum basale. Some forms of blister will develop immediately below the basement membrane of the stratified squamous epithelium. Some forms of pemphigus will show blisters immediately below the stratum corneum, so that the stratum spinosum will still be attached to the stratum basale. However, basic pathology that you should be able to identify for pemphigus will be the presence of a blister in the stratified squamous epithelium. So that blister will be formed secondary to the attack the antibodies, unfortunately, it is still not yet fully understood why the immune system is producing antibodies that will attack normal proteins, normal antigens in the skin. So that is why this is classified as an autoimmune disorder also, pemphigus. That is the common feature of all autoimmune disorders. The cause is still not fully understood, not yet discovered or identified. So, why will edema develop? If antibodies are already deposited in the tissues of the skin or of the squamous epithelium. If antibodies are already deposited in an organ or in a tissue, what will occur next? Activation of the complement system. And then, some cells of the epithelium will die. That is why, after the death of the affected squamous cells, magkakaroon ngayon ng detachment from the underlying layer, yung superficial layer. So, supposedly, nandyan yung squamous cells na namatay na. That is why, because of their death, nag-detach na ang superficial layers from the stratum basale. What will cause the death of the cells which are already the membrane attack complex pa rin? So, it is important to remember the mechanisms involved in the immune system. So, for you to be able to understand how a disease process will develop secondary to the effects of the immune system. So, because of the deposition of the antibodies in the tissues of the epidermis, the complement system will become activated. So, especially because of the effect of the membrane attack complex, some squamous cells will die because of the effects of MAC, and then eventually, because of their death, the affected layers will become separated from the other layers of the epidermis. So that is how blister will develop in pemphigus. So on low power magnification, okay, that is the area of the blister. Okay. So, regular stratified squamous epithelium, keratinized. Our next slide is labeled as good pastures disease with crescents. What are the two organs affected in good pastures? Okay, the kidneys and the lungs. Particularly, what component of the kidneys? Ano? The glomeruli. Okay, dapat na-describe din itong slide na ito as suboptimal. Magawas din siya. Unfortunately, maglabas ito. Because okay, good pasture syndrome or disease with crescent. So that is the crescent now, half moon structure. So we are looking at the histology of a glomerulus. Supposedly, that is the Moman's capsule. It should be lined by what type of epithelium? Simple squamous epithelium. That is the remnant of the simple squamous epithelium. At this portion, the wall of the parietal layer of the glomerulus is already markedly thickened. So that will now be your assignment. So what is the cause of the thickening of the wall? What is deposited to the wall of the glomerulus, what will proliferate? As you can notice, there are nuclei present in the crescent. So you should be able to know what cells are proliferating in the crescents of good posture syndrome, and then in the crescents of the glomeruli, and then what else are deposited to the wall of the Bowman's capsule in good posture syndrome. So basically, that is the pathology or the abnormality that you should be able to identify for this slide. The presence of the crescents in the glomerulus. Okay, for orientation, that should be the low power, that is the low power magnification view. That is how a normal glomerulus should look like. So the entire Bowman's capsule should be lined by simple squamous epithelium. That is the appearance of the affected glomerulus. There is a portion of the Bowman's capsule that is transformed into a half-moon shaped structure. Next slide is amyloidosis. Amyloidosis of what organ? What organ is shown? Kidney. Okay. So, as discussed in the previous slide discussion last week, last Friday, what is the characteristic appearance of an amyloid deposit? Pink, hyaline, or formless, clean-looking deposit. Now, initially, in the kidneys, amyloid proteins will be deposited in what particular portion of the glomerulus? Ano? If that is a capillary, okay, that is another capillary, how will you call, no? Nandyan yung pink, hyaline, deposits ng amyloid proteins. That should be we are looking at the contents of the glomerulus. The mesangium. Okay, mauuna sa mesangium. This why the mesangium will appear thickened because of the presence of pink hyaline deposits. However, late in the development of amyloidosis of the kidney, there will already be amyloid deposits that will be present in the interstitium. However, the first part of the kidney that will be deposited with the abnormal protein should be the mesangial space or the mesangium. So, putting significant distance amongst the capillaries. So, your differential diagnosis now for that histologic appearance should be the membranous glomerulopathy. Can you still remember the abnormality in that condition? Thickening of the capillary wall. So, in this condition, there is no problem with the wall of the capillary. So, concentrate to the thickness of the mesangium in amyloidosis of the kidney. Grabe naman ito. Now, this slide is actually again described as suboptimal. Kasi very pink na yung stain, and then unfortunately folded pa ang tissue dito. Can I borrow another slide on temporal arteritis number 211, please? Thank you, thank you. Okay, this is a better slide. Temporal arteritis, it is called by that name because the disease primarily affects the temporal arteries. Okay? Temporal arteries. What can you say about the lumen of that blood vessel? Okay, the lumen is markedly narrowed. Okay? Now, let us examine what is the cause of the narrowing of the lumen of that blood vessel. So before going to the abnormality, let us first review the three layers of the blood vessel wall. The pointed media is media. And then the pointed tunic is the tunica media. And then that portion should be tunica adventitia, and then that portion should be. So on low power magnification, where is the problem? What tunic is affected? Actually, the intima. Okay, subintima. Okay. So the problem here is the development of chronic granulomatous inflammation in the subintimal tissue of the blood vessel wall. So chronic granulomatous inflammation is characterized by the infiltration of what type? Of white blood cells. Macrophages. Particularly, what type of macrophages? Epithelioid macrophages. Kaya malalaki silang tingnan because they are already activated by what type of cell? The CD4 lymphocytes. So there will be chronic granulomatous inflammation that will develop in the wall of the temporal arteries, causing the narrowing of the vessel wall. Kaya magkakaroon ng decreased blood supply to the tissues of the head because of that narrowing of the lumen of the temporal artery. If this is a chronic granulomatous inflammation, what type of hypersensitivity reaction is involved? Type 4. Okay, low power magnification. That should be the abnormality that you should be able to identify. Narrowed lumen with thickening of the subintima because of the development of chronic granulomatous inflammation. Okay, do you have any question? Okay, none. So that will be all for this slide discussion. Our next meeting is on Friday.
No quiz.
Ano na tayo sa lecture?